Okay, this is video 4 on the day of surgery and what I went through. Before I get into that, this is a really shocking type of a situation, right, to your body, and then for you physically as well as for you mentally. Because there's a lot of things being thrown at you, like, hey, guess what? You may not be able to walk right, you know? You may be in pain quite a bit. And so you're processing a lot of that. If you're a manual labor individual, they told me that I would have to take probably 18 months off and maybe not be able to go back to a manual labor job. I'm not manual labor, but that was part of the discussion, right? Was this could have significant impacts to all sorts of other parts of your life as well. So it is a big shock to the system, and as a caregiver, working with that person, just keep that in mind as well, is they're trying to process a lot of stuff at the same time having a lot of pain, and so there's a lot of inputs that are going on, and you just have to kind of sort through them. Now the good news is that, look, I had a very serious one of the worst, as I said earlier, that my surgeon had seen, and I came through it fine. Really did. Little bit of leftover stuff, but nothing that really dents into any of my life experiences or anything that I can do on a day-to-day basis. So believe me, you can get through it. You really can. But it's a process, and you got to get through it. Okay, let's talk day of surgery. So my surgery was scheduled at 7:30 in the morning, so we got up early. The night before, they asked me to take a shower with a liquid soap that they provided, or that I was able to get down at the pharmacy, to do that before I went to bed, and then before I actually came to the hospital. So I did that, got there. It moved fairly quickly, right? They put me in. Anesthesiologist came in, double checked on everything. Doctor came in, took a look at the leg. They put the IVs in. They put chest monitors on. They did all the typical stuff that you have done. And then they just wheeled me into the room. Of course, it was very cold in the operating room, but they had me actually physically get off of the gurney that they brought me in to get onto the operating table. They, of course, all had on, all their garb, and they had the helmets over the top of them, because it's, I guess that, they need to make sure that they're extra careful on germs and that type of stuff. So they got me in there, basically kind of got my leg situated, and then they hit me with the propofol, which knocked me out completely. And then, the next thing I knew, I was in the recovery room. When I woke up, I didn't have any pain at all. At that point, they said that I was still on a lot of pain medication. I actually thought that they may have put one of those pumps into my leg that then I could just, hit the button, when I went home to release pain medication. But they didn't do that. They actually just gave me oral medication. So we got that taken care of, got that picked up, and then came home. Frankly, I don't really remember a lot about that. My wife brought me home. I got into bed, pretty well crashed for 12 hours. But she was getting me up to take the pain medication, so I didn't get behind on the pain medication, which was critical. A couple of points on this is, one, you want to be careful what type of car you bring when you get there. There's no way that I could have gotten up into a vehicle that was much higher to try to step into something. Just wouldn't have happened, right? So, probably a vehicle that's lower to the ground would be better to get in and out of. My wife had the bed already for when we came home. She could just, throw me into the bed and be ready. Have some light food ready to eat, even though I wasn't hungry. But when I did wake up, I wanted to eat, but I was a little, I wouldn't say nauseous, but I didn't want a heavy meal at all. They'll have you put ice on it as well. Also, when you're driving home, make sure that you've got a barf bag. I didn't need it, but the medication that they put you on can cause a lot of nausea. So that was one other thing that you may want to talk about with the anesthesiologist, is to make sure that you have enough, that they kind of double up on the nausea medication if that's a problem with you, which I did tell them that that was a concern of mine. So they took care of that, and then I didn't have any problems. But then I got home and started the recovery process. And when they put me into recovery, by the way, I think I was there for 2 to 3 hours. By the time I woke up, I actually slept about an hour into the recovery room, maybe an hour and a half in recovery. They knocked me out so well. And so then I was in there for about another 90 minutes or so, and then they released me to go home. So, I was on my way home by 2 o'clock in the afternoon after having the surgery at 7:30. And just some thoughts on that. We'll now go into, on the next video, what happened kind of in the recovery going forward.